You may have been wondering who put that thumbtack on the teacher's chair. Well, it's probably pretty obvious now. This bully kid front and center, of course. Notice that he's also being a bully to the student in the black shirt by kicking open his lunchbox. His lunchbox has a slab of raw meat in it and looks kind of like a transplant cooler, which should make you think of transplant. It's also being kicked away or rejected by the bully, which should make you think of rejection. Together, these ideas should help you remember that tacrolimus can be used for acute transplant rejection. All right, now let's discuss the side effects associated with tacrolimus. The poor student lost his lunch meat, but the good news is that he still has his green kidney beans. If you look at the one green bean on his desk, we can see that someone has taken a bite out of it, which alludes to the idea that the kidneys are harmed by tacrolimus. So these beans are here to help you remember that tacrolimus is nephrotoxic. Now we've shown the bully eating some sausage links. He must have pulled them from the lunchbox before he kicked it across the room. This is our symbol for neurons because the sausage links resemble neurons. And it's in this part of the image to help you remember that tacrolimus is neurotoxic. As the lunchbox flew across the room, it clashed into the trash can and caused a bunch of dust and infectious particles to fly up into the air. These distinct infectious particles should help you remember that tacrolimus increases the risk of infection. This makes sense, right? It's an immunosuppressive agent, so patients are more likely to get sick when using this drug. Towards the back of the classroom, we can see the good side of humanity. Notice that there is a bald girl sitting on her desk with a cancer hope ribbon around her neck. She must be going through chemo and is now going bald. Her friend is kind enough to cut off a piece of her own hair and offer it to her. Anyway, the cancer reference should help you remember that tacrolimus increases the risk of malignancy. Finally, if you look closely at the girl giving her a lock of hair, you can see that it has many dyed beads in it. This should make you think of diabetes and is here to help you remember that tacrolimus increases the risk of diabetes. All right, that should be everything you need to know about tacrolimus.